And I want to help you maybe understand some of the context behind United Healthcare, because more than 26,000 Americans die each year because of the lack of health insurance. More than twice as many as were murdered. And that alone can give you...
Like, I don't know what this means. Like, 26,000 Americans die each year because of a lack of insurance. Like, this is not true. You can't die because of a lack of insurance. You die because of a lack of healthcare. So does this mean that they were denied something that should have been covered under their policy? Or does it mean that, like, because insurance doesn't save you, insurance helps you get access to healthcare? Like, what does this mean? Or was this because they just didn't have health insurance at all? Like, but okay.
Americans die each year because of the lack of health insurance. More than twice as many as were murdered. And that alone can give you at least a starting point, right?
Wait, what did that say?
Because of the lack of health insurance. More than twice as many as were murdered.
Because they lacked health insurance. Twice as many were because they lacked health insurance. Okay, so they didn't even have health insurance. Okay.
And that alone can give you at least a starting point, right? United Health Group, which is the parent company of United Healthcare, is the 8th biggest company in the world by revenues. And infamously, they say that, with great power comes great responsibility. Except I don't think anyone told United, because on average, 16% of insurance claims are rejected.
Oh, God. It's not going to be the meme chart, is it?
In the healthcare space. For United Healthcare, it's 32%, meaning that around 1 in 3 paying customers has their claim rejected.
So like so we saw this on Lab Reddit comment, and I'm sure we could dive into this more as well, right? So even looking at this claim denial rates by insurance company, you might look at this and say like, oh, well, Kaiser is a really good company because they don't deny anything, right? But Kaiser in-houses almost every single part of the process. You cannot leave, and there are hurdles to jump through within network in Kaiser to get treatment, but their denial rate is very, very low because so much of it is part of their whole thing that they do, right? The ironically enough, their vertical integration of the healthcare to the insurance to everything else. So a low number here is not necessarily good. I don't know if a high number is necessarily bad. Like, you need more information than just like a single stupid fucking chart. But
United Healthcare, it's 32%, meaning that around 1 in 3 paying customers has their claim rejected. This just scratches the surface.
Can you explain the Anthem time limit thing, please? I haven't read much about it. Why are you arguing it's good? It's fuck me, dude. I can't. Doctors, when they negotiate, they're not negotiating to make it so that their patients are happier and healthier. Doctors are negotiating for their wages, which they should be. That's it. Healthcare people are negotiating to pay less. Doctors are negotiating to charge more. For the anesthesiologist thing, one of the issues that insurance companies run into are sometimes doctors will overbill because they know that they can get more money out of the insurance company, which rolls downstream to patients. It means we all have to pay more for health insurance. There was a negotiation between the insurance companies and anesthesiologists saying, hey, you're not, like, we know what the average time is for an anesthesiologist. We know what the average length of a surgery is. You can't just bill us more for every single one. You have to have an extra reason for this. But also, as part of the agreement, you're not allowed to roll that cost onto customers either. You have to pay this out of pocket. You can't charge more for this as well. And the anesthesiologist turned around and presented this to the public as, oh my God, they want you to have your anesthesiology wear off when you're in the middle of a surgery. And that's how you fucking retards took it. And that's what everybody ran to the streets saying. And then you simp dipshits ended up basically championing the cause of a bunch of insanely overpaid doctors. I shouldn't say overpaid, but really well compensated doctors in their negotiations against insurance companies. That's it. On this case, the insurance company is technically negotiating on your behalf when they negotiate for lower prices, but you don't even realize that because you just think everybody's evil on the insurance side and everybody's good on the doctor side. If you want, you can go and read there's a Vox article that goes over this. Maybe there's more detailed information, but I don't, and somebody can link it with something different, but there you go. This is an article on that if you want to read it. And it's Vox, who's super ultra far left.
And we can go a little bit deeper and find out a little bit more. Given that the insurance industry rejects claims at such a high rate, you would expect some of those savings.
What does this mean in practice for the person under anesthesia? Nothing. It just means that the doctors wouldn't be able to charge as much. That's what these negotiations were about. Charge the insurance company or the patients as much. Anesthesia services are billed partially on the basis of how long a procedure takes. This creates an incentive for anesthesiologists to err on the side of exaggerating how long their services were required during an operation. And there's evidence that some anesthesiologists may engage in overbilling by overstating the length of a procedure or the degree of risk a patient faces in undergoing anesthesia. Starting in February, Anthem had planned to discourage overbilling by adopting a set of maximum time limits for procedures inspired by data from the Centers for Medicare and Medicaid Services. If an operation went long for medically necessary reasons, anesthesiologists could appeal for higher payment, but the process of reimbursement would be more arduous. Critically, contrary to Senator Murphy's claims, this policy would not have settled patients with surprise bills if their operations went over time. The burden of that cost control would have fallen on participating anesthesiologists and not patients, according to Christopher Garment, Associate Professor of Health Administration, blah, blah, blah. You can go read this if you want. But
a little bit deeper and find out a little bit more. Given that the insurance industry rejects claims at such a high rate, you would expect some of those savings to maybe have been passed on to the consumer. And so I decided to check, how have insurance deductibles and premiums changed over time relative to wages and inflation more broadly?
And it's going to be because they've gone up. That means that no money was saved, but it could have gone up more, so we're not even going to factor that in. It's all good.
And the answer was not well. Between 2010 and 2020, the cost of deductibles has more than doubled, and the cost of family premiums, the monthly payments, increased by over 55%. And today,
Changing deductibles, this doesn't even mean anything. Like, people might just be choosing higher deductible or lower deductible insurance. This wouldn't necessarily be a good or bad thing, right? Monthly premiums going up sucks, though.
low-income families spend close to a third of their income on health insurance premiums. It's not good. Just showing you numbers doesn't really capture the full picture, because sometimes it can be easy to get lost in the numbers and to understand how this actually translates into human impact. And ProPublica just last month published an amazing article about United Healthcare's.
Destiny, a comment talking about I hear is that new medications are allowed to upcharge an insane amount until a certain amount of time on the patent passes. Do you know anything about that? I mean, new drugs cost more, but Americans also want new drugs, right?
Playbook when it comes to mental health. ProPublica, because sometimes it can be easy to third of their income. Family premium.
Wait. Okay.
The insurance premiums. It's not good. Just showing you numbers doesn't really capture the full picture, because sometimes it can be easy to get lost in the numbers and to understand how this actually translates into human impact.
Would universal healthcare make this a non-issue? No. It probably would reduce costs a little, but again, Americans would have to cut from something, either the latest cutting edge technology, the speed at which we have access to them, or the cost of the taxes or whatever that you pay for it.
And ProPublica just last month published an amazing article about United Healthcare's playbook when it comes to mental health coverage. And this will really help you understand how all of these numbers actually translated into human impact over the years. United Health Group, the parent company, has seen their revenue grow by over 47 billion in the space of a year. And to achieve such massive growth in an industry like healthcare, you need to rely on the same playbook that other industries have relied on, which is optimization through technology. Massive Health Group, the parent company, has seen their revenue grow by how all of these numbers actually translated into human impact over the years. United Health Group, the parent company, has seen their revenue grow by...
These margins are not that high. 5.8%, 5.8%, 6.3%, 6.0%, 6.2%. These are not big profit margins. Jesus.
Over 47 billion in the space of a year. And to achieve such massive growth in an industry like healthcare, you need to rely on the same playbook that other industries have relied on, which is optimization through technology. United Healthcare implements an algorithm called ALERT, algorithms for effective report and treatment, to determine whether or not a person undergoing mental health treatment has had too much therapy. If a therapist passes an arbitrary threshold, they get contacted by what's called a care advocate, who will call them and grill them for providing too much care to their patients. The official term for...
What does insurance bring to the table? Charge a shitload and doesn't cover a lot, plus deductibles. Paying into universal over premium seems better. Then just don't have insurance and just pay out of pocket then when you go to the hospital. No one's making you not do that if you want. Just don't buy insurance. Just if a medical emergency comes up, just go to the hospital and pay out of pocket for it then. No one's forcing you to buy insurance right now. Do you agree that single payer would be cheaper? It would be a little bit cheaper, but I don't think it would be meaningfully cheaper, such that now all of a sudden it's everybody in the United States can afford everything. Like, you're either gonna have to pay a huge tax burden on wealthier people, including middle class people, because believe it or not, the top 1% can't afford fucking every social program you want, but you'd still have to cut from what we offer people in healthcare in the United States.
For this is the risk of overutilization.
Also, I don't know why he says, I don't know where he says they call you after an arbitrary time. I'm sure all of this is based on like studies and numbers and like everything else.
Care advocate, who will call them and grill them for providing too much care to their patients. The official term for this is the risk of overutilization of routine outpatient services. What this looks like in practice is pretty crazy, I think. I want to give you a testimony.
You just dodged the guy's question by saying pay out of pocket. That's just pay more in taxes argument from right-wingers. No, because paying more in taxes is you throwing money into a massive pit that is supposed to cover 300 plus million people. Paying out of pocket is you paying individually for your own particular thing if you want. What do you mean?
Testimony from a patient who had their claim for mental health treatment denied. She's pretty crazy, I think. I want to give you a testimony.
Okay, now we go to individual patient testimony because we never have numbers to actually prove any of our points here. Okay. 2 years ago, my therapist denied payment for 7 of my mental health sessions she provided. I tried to pay her, even though I'm on unlimited income. She wouldn't take my money from my provider, and her percentage, I believe, in any of the service. Who is United Health to deny coverage?
From a patient who had their claim for mental health treatment denied. She said that 2 years ago, my therapist was denied payment for 7 of my mental health sessions she provided. I tried to pay her, even though I'm on a limited income, and she wouldn't take the money. If my provider, in her professional opinion, believed I needed those therapy sessions, who is United Health to deny coverage? And if you're curious about what too much therapy actually looks like, it is 30 sessions in 8 months.
What would you have to cut in a single such multiplayer system? Does the US healthcare offer more services than elsewhere? Yes, we always have the most cutting edge drugs and the most cutting edge surgeries, and Americans seem to prefer these things more than anything else. That we have a huge choice for having super cutting edge on all of this stuff. We always want the latest and the greatest and the best and whatever is most recently available. It's a huge thing. Nobody wants the older, shittier drug. Nobody wants the older, shittier procedure. We always want the latest and greatest on everything. Destiny has a narrative and doesn't want to have it challenged. This is like the 4th video I've watched on this topic. If you want to change my mind, link some data, not a sad story. right? What are you talking about? Considering a lot of medical research and development is already paid for with government money, is there a reason we couldn't just decide to let the government do that research itself and eat that cost to society? Because the government, there's no public funding doesn't bring drugs to market. It engages generally in like general research.
This was the threshold for initial flagging, which if you fancy yourself as a mathematician is like a bit less than once a week. And this might sound like an uncharitable description, right? Like they were hunting down people for having too much therapy, but it got to the point in New York where the Attorney General...
See, like here's another problem too, is that like retards think that it's like, this is, God, what a waste of time to even have this fucking retarded conversation. And you guys are fucking retarded too.
Too much therapy.
Like can you have too much therapy? Like the idea is that every healthcare expenditure and consumption is good. Every single thing you could possibly get is good. There's no such thing. Like there's a huge RAND study, I think, that spoke against this too. Like you could never overconsume healthcare. You could never go to too many therapy sessions. You could never go to too much physical therapy. You could never have too many tests. You could never have too many drugs. You could never, like, it's like this, it's just the most childlike, naive, stupid fucking, that every single person who works in this industry will tell you is a bullshit assumption, and all of it is bullshit. But like but then we just have this whatever.
Actually looks like. It is 30 sessions in 8 months. This was the threshold for initial flagging, which if you fancy yourself as a mathematician is like a bit less than once a week. And this might sound like an uncharitable description, right? Like they were hunting down people for having too much therapy, but it got to the point in New York where the Attorney General actually sued them for it, and they just recently settled for $13 million. These $13 million covered around 34,000 therapy sessions that were missed. And I would just ask you to speculate on what you think the cumulative mental health impact of 34,000 missed therapy sessions would be, because it's not good. And this algorithm remains in place today in the vast majority of the US. The algorithms that United Health have implemented over recent years are officially said to be suggestions, but leaked messages from whistleblowers have implied that workers are being told to stick within 1% of the algorithm's recommendation. The AI that's used to evaluate these claims is notoriously faulty, and they're currently undergoing a lawsuit which claims that it has a 90% error rate, meaning that 90% of the claims that were rejected could be later overturned with an appeal. However,
for one particular age group, though, this wasn't for across their entire thing. And this is just what a complaint is alleging. We don't even know that. I didn't see any evidence in that complaint that was even true.
But it has a 90% error rate, meaning that 90% of the claims that were rejected could be later.
Notice how Destiny doesn't speak on the numbers once he asked for them. What numbers? What am I missing? Why did you not comment on the 0.8 sessions a week? Is that not a completely reasonable amount? I don't know, but you don't know either. You have no idea. You just hear a thing and you think it sounds good.
Overturned with an appeal. However, it's unreasonable to expect someone to appeal when they are unwell. It's one of a number of pieces of evidence that...
Right.
However, it's unreasonable to expect someone to appeal when they are unwell. It's one of a number of pieces of evidence that the number one priority was not necessarily providing effective healthcare, unsurprisingly, actually. However, even if you're not...
Please make the case that doctors are overpaid. Who am I? Doctors are expensive. I've never said they're overpaid. I don't know what the appropriate compensation should be for a doctor. Our doctors are paid the most in any healthcare professionals in the world, but we also take on more debt than anybody else in the world to become a doctor. And our licensing processes are like incredibly fucking hardcore, I think, compared to other countries as well. So I don't know if it's overpaid or not.
Medical staff, or you're not a patient and you're just a healthy American adult, you're actually still getting screwed over by them, because United Health specifically exploits the Medicare Advantage plan. Medicare Advantage is a healthcare plan that represents a public-private partnership. People get insurance with a private company, and the company is later refunded by the government. It allows health insurers, which have experience and have vast networks in the healthcare space, to use that, and it allows the government to not necessarily bear the cost of all the infrastructure that they need to provide medical services. And if we understand how it works, you realize that it's not necessarily as good of an idea as it might seem at first. There are some statistics that kind of like live rent-free in my head, specifically one about...
You're permabanned. Destiny's too far gone on this. Bye. Leave. If you don't like my take on this, please fucking leave. Because the thing that bothers me the most isn't that you disagree. This is that you hear me on some other thing and you think you're agreeing with me because you're agreeing with my rational reason, but you don't actually give a fuck about any of that. You just hear me give like good conclusion and you like it. So if this is something that's triggering the fuck out of you because you believe something because of stories, okay, because of narratives and because of tweets, then fuck off. If you have like a source or like an actual paper or something written up that's more comprehensive on this, then we can review it. I haven't seen any information like that. Oh my God.
Hey, Dr. Schmidt, do you have a second?
Yeah, what's up?
Oh, I just wanted to debrief after that colonoscopy you just did.
Debrief? Sorry, remind me who you are?
Oh, sorry, I'm Jeff with Anthem. I'm your designated procedural efficiency supervisor.
I thought you were just here to shadow the CRNA or something.
No, as of the first, Anthem requires a procedural supervisor to observe all procedures to ensure maximal efficiency and minimal resource misallocation.
Resource misallocation?
Let's just dive right in. For the first 2 minutes and 37 seconds of the procedure,
like, before we watch this, I don't know if you guys understand this or not. If we were to have a single payer system, you understand that this guy would still exist, right? When they talk about the government negotiating drug prices, that's what this is. It would just be the government doing it instead of insurance companies doing it. You understand it would be the exact fucking same thing, right? Like,
You were advancing towards the Kikam.
It's the cecum.
Yes, thank you. You told the story about how your daughter just got a new puppy.
Yes.
Well, our research shows that discussion of details not immediately pertinent to the procedure at hand slows procedure time by about 24%.
What study shows that?
And as a result, we have to decline patient coverage and cancel physician reimbursement for any such portions of the procedure.
What? You can't do that?
Yes, we can, but don't worry, it only amounted to about 12% of the procedure. Look, I don't. Moving on, this patient's Boston bowel prep score received a 7, which falls into the good category.
Right.
Therefore, we're going to reduce your reimbursement by 10% and only cover 90% of the patient's bowel prep.
No, a bowel prep score of 7 has been shown to have an equivalent polyp detection rate.
But it slows the procedure by an average of 10% and therefore does not have an equivalent financial efficiency rate.
Financial efficiency?
And then finally, you removed a polyp with a snare even though you had already used a forceps earlier in the case.
Right, because the snared polyp was 5 millimeters in size.
You wasted time and resources switching devices when you already had one available to do the task at hand.
Using forceps on polyps over 3 millimeters in size increases the risk of incomplete resection and therefore colon cancer.
Well, due to the sheer number of polyp removals you perform, our financial efficiency quotient for you still favors incomplete resection since colon cancer is comparatively rare.
At this rate, not for long.
Now, I understand you're upset. Ordinarily, I would say you could try to do better on the next one, but unfortunately, you made enough efficiency errors that you'll have to switch to an observer role while I perform the next colonoscopy.
What?
That's our standard policy.
You don't have a medical degree.
No, but I have an MBA, and I've watched over 100 colonoscopies already.
That doesn't matter.
And frankly, with your significant financial inefficiency rate, this decision is what's medically best for the company.
like, the government would be making these exact same decisions. The government doesn't have infinite money to spend on this shit either, right? You are aware of this, you know? Can you elaborate further on your belief that Americans prioritize cutting edge / fast healthcare? Is there a center for everyone? The most in-depth thing I've heard was these, what was listening to this guy talk
And
about,
distribution.
what the fuck was this guy's name? Dr. Saum Sutaria. Here, you can go watch this if you want. And you can go and find out things if you want as well. Here you go. And house.
About the patient.
About healthcare spending per person. Because the US notably spends way more than any other comparable country. The UK, which has a completely free at the point of service healthcare system, spends less than half the amount per person on healthcare. And this was a number that just never really added up in my head. I didn't understand how the US was able to spend this much money. And understanding the Medicare Advantage plan actually explains a little chunk of this figure a bit more to us. You see, Medicare Advantage works by giving an insurer a fixed amount of money for a healthy person. And that amount of money varies depending on how sick the patient is. So for example, they may get an extra $2,300 if the person is morbidly obese, an extra $2,000 for seizures, an extra $1,200 for chest pain, because the logic is that it would incentivize doctors to fully diagnose patients and to not miss any corners with these Medicare Advantage patients. It's also worth noting that not every extra diagnosis leads to an extra payment. So for example, cataracts are paid out, but only if you contract them due to diabetes. Except there's always a loophole, right? Because United Healthcare wasn't happy with the payouts that they were receiving. And the Wall Street Journal wrote about a number of cases where United Healthcare would actually try and offer people extra money to get more diagnoses out of them. If they felt that the patient's doctor hadn't provided enough diagnoses for the patient to be worth it, they would call the patient and ask if they could send a nurse out to give them a checkup. They would even offer a $50 gift card to encourage them to get this visit by a United nurse. This is completely separate from their actual medical center that they might visit on the regular. And this led to...
Assuming he's summarizing the story, this is obviously a bad thing.
The person mentioned in this article, Gloria, being diagnosed with a condition that she didn't actually have. A condition that led to United Healthcare getting an extra $3,000 and led to her receiving a diagnosis for something that she didn't suffer from.
While the government doesn't have infinite resources, we expect the government to not always perform at the absolute peak price efficient options, right? i.e. USPS providing postal service to Americans who would not be able to access USPS / FedEx since those routes are losses. Sure, but it's different with healthcare is not the same as delivering the mail, because I think we have the resources to deliver the mail adequately to every single person in the United States. However, we don't have the resources to give the level of healthcare that Americans that pay for insurance through their work expect to every single person in the United States.
And this isn't just an isolated case. If we look at the number of patients diagnosed with cataracts that were part of United Health, they actually diagnosed at a rate 15 times higher than traditional Medicare. And the vast majority of these diagnoses are not done by the patient's doctor. Rather, United Health just adds on diagnoses in order to extract more money out.
Why not? Because we don't have enough doctors. We don't have enough hospitals. We don't have enough machinery and equipment. There's not enough money in the system for that. It's an insanely huge...
of this Advantage plan. And when you look at conditions that don't lead to an increased payout, you don't see anything near this level. To highlight how egregious this actually is, more than 6...
How do you justify the innovation argument? The most innovative weight loss drug, Ozempic, came from Denmark, where healthcare is relatively socialized. Doesn't this mean... First of all, you're talking about a single drug? Number one. Number two, I think the trialing for Ozempic to be used for weight loss was done in America, not Denmark. And number three, I would have to look into the company in Denmark. I don't even know how their financing structure or whatever works. It might be a company that's heavily financed or subsidized by an American company. I'm not sure.
66,000 Medicare Advantage patients were diagnosed with diabetic cataracts, even though they'd already gotten surgery for it. And it's interesting to consider the fact that United Health is 15 times more likely to diagnose patients with this condition, and yet around 1 in 3 paying customers has their claim rejected. A plan was even hatched to reform the Medicare Advantage plan to prevent this kind of overbilling, but it was shut down after what was described as strong industry opposition. As usual, it does come down to lobbying, because United Health Group is a huge political donor. They donated over $10 million in lobbying in 2023. I visited Open Secrets just to have a look at what their donations looks like, and yeah, you can see they literally give money to everyone. It's not too hard to be surprised surprised as to why there's not been much pushback or much mention of such insurers, except by independent politicians. When we take even just a brief glance at their list of donations, the cost of medical care in the US is like inflated at every step of the process. And United Health did not.
It isn't just money, Destiny. The different participants are incentivized to extract rents along the way. Why are there so few residencies available in the US? So yeah, extracting rents. Yeah, I haven't repeated this point because I don't know if it's true, and I'm so fucking retarded. I don't want to come off as more of a big whatever shill as I already am, apparently, just because I'm asking for numbers. But I've seen people type in chat a lot that the reason why residencies are limited is because the AMA literally tries to artificially limit residencies to create more scarcity around doctor jobs so they get paid more. I don't know if that's true or not. I just see a lot of people pasting that in chat. There's no point in me even looking that up, because if you already are against me for no data or whatever, no amount of data I'm going to show you is going to convince you otherwise, so I don't give a fuck. Jesus. Last year, the 7 largest private health insurers collected $1.39 trillion in profit. It is absurd that big insurance is raking in trillions, while Americans are pinching pennies to afford treatment. Correction, the largest U.S. health insurance companies had $1.4 trillion in revenue and $70.7 billion in profit. Nobody said that's not true. Congress limits the funding more than AMA limits spots. Here needs to be more federal funding for spots. Oh, we've got Dr. Mike.
Let's say I'm following a patient's tumor size. We need an MRI to see how the tumor is behaving. The insurance company will deny it. I will call them. I will say the patient needs, why? Because of this. Did you get a CAT scan first? No, they don't need a CAT scan. They need an MRI. No, they do. And I have to argue for 45 minutes. Yeah. Guess what I don't get paid for as a doctor? Well, for me, I'm a weird scenario, but everyone else, time. If you're a lawyer, are you doing anything for 45 minutes without getting compensated?
I don't find that doctors will call and argue.
Most doctors will try, and then we fail. So then we start trying to hire administrators to do it for us. And that is why healthcare costs have ballooned in this country.
I see.
Our healthcare costs have doubled, tripled. Doctors should be making way more money. They're not. I order antibiotic. I don't know which tablet. Double it for us, and that is why healthcare costs have ballooned in this country.
I see.
Our healthcare costs have doubled, tripled. Doctors should be making way more money. They're not.
I feel like this is cut. Like, is that doctors should be making way more money right after healthcare costs have tripled? Is this cut or edited or?
They're not. I order antibiotic. I don't know which tablets, capsules. The patient's insurance denies the visit because I didn't put the right code or this and that. I'm a doctor. I do science. I do the body. I don't do codes. But now you have to become like a business person, a lawyer, a doctor, all in one.
But again, the objective of the insurance company is not to pay.
Okay. Like, here's a question. If government health insurance and all that is so good, why doesn't every single health facility accept Medicaid and Medicare? You realize that people struggle dealing with these government entities as well, right? Like, it's not like the government is just like magically. Okay. Oh God, the Charlie. Does Destiny disagree with the point about a healthcare company trying not to pay? How would that be different from a union representing its own interest? Surely money is their interest. I don't think that an insurance company's goal is to never pay out, because if their reputation was too bad, then they wouldn't have any customers, because people are like, this insurance company sucks, don't ever go with them, right? So to some extent, they have to keep their customers happy to some extent, unless you want to go off the deep end and just think that, no, actually, this is the only part of this entire system that's uniquely evil. But yes, an insurance goal is to make as much money as possible. A hospital's goal is to make as much money as possible. A doctor's goal is to make as much money as possible. Every single person along the stage is incentivized to look out for their own interests. Okay, that's how it works.
Become the 8th biggest company in the world by revenue just through providing health insurance. Rather, what they've done as well is they've systematically acquired all sorts of different parts of the healthcare stack. So acquiring groups of doctors, pharmacies, nursing homes, and adding those to the stack. Therefore, they can effectively control how
Destiny, you live in a utopia. Keep in mind that I'm the one with the polling data yesterday, by the way, that showed that like 80% of Americans are either very happy or okay with their insurance. Keep in mind, okay? You're the one who thinks that everybody fucking hates it because you're on Twitter too much. Just to be clear, okay?
how much you're charged at every step of the process. And they can ensure that no matter where you are in your treatment.
Destiny, please do note that one of the reasons why MRIs require prior authorizations is because they were being abused and overused in the past. Okay, maybe. That might be true. I don't know. What is your opinion as to what the actual problem is? It's just, healthcare is just very expensive in the United States, and people think that they can do anything to just get around that fact. So they want to blame somebody for it. But the reality is just the cost of the hospital, the cost of the doctor, it's just very expensive.
You're being seen by United Health Group. There are laws in place that require insurers to take no more than around 15 to 20% of the premium for like profits. But by acquiring other parts of the stack, they're able to systematically inflate prices across the board. And people have seen that reflected in higher medical costs. And so it really feels like it's reached a boiling point. There is only so far you can push people before one of them eventually snaps. However, the thing is, United Healthcare isn't necessarily an outlier. It's simply the most egregious example of an infamously quite broken healthcare system where
So is the root problem closer to why treatment costs so much to begin with? Seems like the free market is failing to provide a cheap and high quality product. That's not true. The free market is providing products. It just isn't providing products for everybody. A market's goal is to just maximize profit, not to cover every single person. This is why government intervenes in some places, because you probably want more people covered than just some people having extra high quality access to things.
Insurers are rewarded for not actually providing care, for doing anything but providing medical care. And the impact from a civilian perspective has been witnessing death, injury, and illness throughout their lives. I think a lot of the reaction hasn't necessarily been sparked by knowledge of the
How do you justify the profit seeking versus the outcome disparity in other nations? I don't even know if the outcome disparity is that serious. I'm not even sure if that's even true. Well, in terms of what we pay a lot more for sure. How can you simply write off economies of scale? I don't know what you even mean when you say write off economies of scale. I don't know what you mean here, but
the specifics of the scale of the criminal activities that they've engaged in over the years. But it's about something much more visceral, right? About an understanding that their health has been effectively sold off to the highest bidder. And you don't have to necessarily know about specific violations of Medicare Advantage plans to be able to feel that. Nor do you have to know about how they treat doctors as well. But rather, you just have to know about how they treat you, your family, and your peers, which appears to have been almost universal.
So how do other countries do it? Have cheaper plus arguably better healthcare taxes? Other countries do not have access to the same types of treatments and drugs that we do. Like the one example that I can give personally is I'm pretty sure it took, like for instance, like Adderall or Vyvanse took longer to get to a lot of European markets because they preferred to sit on methylphenidates, to use Concerta and Ritalin. Whereas in the United States, as soon as a new thing becomes available, like we have them immediately because we want the best and latest and greatest drug, like immediately. Or I did the bullshit poll in my chat yesterday for what it's worth. I don't know if there's larger data on it, but when we looked at, like in the United States, what was it? Like 80% or something of people in my chat who were Americans, when they got their wisdom teeth pulled, like 80% of them had general anesthesia for it, or they were basically on knockout gas. And it was almost the exact opposite for Europeans, where it was like 80% of Europeans just had local anesthesia. But Americans they want more. They just want the more shit. They're like, oh, fuck, yeah, like knock me out, doctor. Wait, so are you denying the commonly stated stat that Americans pay more for less when compared to European countries? It depends when you say pay more for less. It depends on what you're talking about. Pay more for less what? Outcomes or access to drugs or treatments? Or it depends on what you're talking about. It was 304 people said they were American and they went under general anesthesia. 176 said they had local anesthesia. So it was 2-1 for this. And then for Europeans, 183 said they had local versus 37 said they had general. It's like 6-1 here.
Unanimously negative. The lowest income people spend close to a third of their income simply servicing the cost of having health insurance, which is extremely unlikely to pay in their moment of deepest need. And while I can't necessarily endorse anything anyone has done, I can say that I am surprised that this hasn't happened sooner. I think many people have a mental block where causing a death in a legal manner is seen as not being as bad as causing a death through an illegal manner. And it's not too much of a surprise that it was a matter of time before.
Yeah, well, of course these are two dramatically different things. Like, you understand that in real hospitals, like triage and stuff is a thing that happens. You don't always have resources for every single person all the time. It's way different that somebody dies because of something like that versus somebody murders somebody.
Someone felt like the legal system didn't adequately punish people who caused deaths in ways that were seen as being within the law. That one person has come to represent an idea that's way broader than just them. It represents deep frustration that people have felt for many years, and it's only now being directed towards the people who have perpetuated the system, which has caused them so much pain over the years, and which has affected people across the nation in a way that most issues really don't.
Okay. Methamphetamines are still illegal in France. You can get methylphenidate. It's kind of limiting. Is that true? I don't think it would be methamphetamines. Also, it would just be amphetamines. But there are huge wait time in Canada to see a doctor. It depends on the procedure you're getting.
Yeah,
Do you have a primary care doctor?
I do.
Do you have a good relationship with them?
No.
I love your honesty.
No, until recently. See, I wanted to go to a concierge doctor to eliminate a lot of the paperwork and referrals and everything else.
Yeah.
But it doesn't really work that way. I think I'm with the wrong guy. I actually, maybe afterwards, or maybe now, get your advice. How do you...
In a lot of EU countries, ADHD drugs with meth, like Vyvanse, are illegal. It's not meth. It's an amphetamine, but it's not methamphetamine. I don't know why you're saying with meth in them.
Pick a good concierge doctor, and what are they expected to do?
When you say concierge doctor, what are you looking for them to do?
I'm looking for them to help out when you're in an emergency ward, to get some attention on a patient that needs attention.
I would find a primary care doctor that has admitting privileges in a hospital.
Great advice. They don't all have admitting privileges.
Some do, and some that do don't use it. So, for example, my father has...
Because they don't...
What is the difference? A methyl group. Oh.
don't want to use it.
Yeah, like they
Yeah.
want to be office-based physicians.
I see.
My father, for example, he's the same type of doctor that I am, family medicine. He has admitting privileges in an NYU local Brooklyn hospital, but he doesn't go there. So
Yes.
he sends his patients there. He can admit them, but he doesn't take care of them. The team there takes care of them. The hospital.
That's not so bad though, as long as you can get in.
Oh, no, for sure. But where I did my training, for example, in Atlantic Health in New Jersey here, when I would send a patient to get admitted, I would then take care of them while they're in the hospital.
That's what I want.
Yes.
Yeah.
So you need
how
a-
do you find that person
You need a family medicine doctor with admitting privileges who does inpatient medicine.
and who isn't in New Jersey?
Well, yes.
yeah. In New York.
But you grew up in Jersey.
I grew up in New Jersey, but
Edgewater.
I live in the city and I want to be close to a hospital
Okay,
here.
sure.
Yeah.
Do you live nearby in the city?
I live on 97th and 5th.
Oh, okay.
Yeah,
so
very close to Mount Sinai.
not too far.
Now, let me ask you another question. I don't mean to interview you, but I'm so
This is
curious.
great, yeah.
Okay. When you call an ambulance, 911, must they take you to the nearest hospital?
I don't even know what the newest and greatest drugs and procedures are out there. My doctor does. I don't know if you're American or European. I'm guessing you're European, but in America, we have like literally fucking, we have commercials and shit for drugs and stuff. So we literally have it advertised to us, which is stupid.
That's what I was told. I don't know if that's true.
I think they probably do. I think it's like an insurance thing.
So let's say you're my doctor, you're at Mount Sinai, and you're the farthest hospital away. Can I say, my doctor's at Mount Sinai, that's where I want to go?
I think you can.
You can, yeah. You don't seem sure of yourself.
I'm not sure.
I could tell.
That's not my specialty. I can find out.
You don't have to find out.
No, I will find out.
Okay.
I think it's important for you to
All
know
right.
that. But yeah, I think also the whole ambulance system and transport system in our hospital is so shady and it can become so expensive. Like that's why people are Ubering now to hospitals when they're having emergencies, and that's
Oh, you
really
mean the
dangerous.
patient pays for the ambulance?
Well, your insurance ends up paying for it.
Oh.
And they charge ridiculous sums of money, so people don't want to go because they don't want to. Like, if they haven't met their deductible, they end up having to pay that.
Oh.
And it's really expensive, overpriced at times. Then, like, let's say you're in a hospital system and you need to get transported to a faraway place, but you're unstable. You would need to go on a helicopter. Those things are even worse because they don't tell you prices up front, and they act like it's a big emergency. And all of a sudden, you're fronting $100,000 transport fee.
Wow.
Yeah.
Wow. I should check my bills. I assumed I
Do you
was
get
not
helicopter to
paid. Not a
hospitals often?
helicopter, but the ambulance. I don't think I'm charged. I don't know that.
Well, I mean, your insurance probably gets
Next
hit
time I
with
say to my husband, walk.
it. No, get the ambulance is the most important part. That's why it's worrying to me that Ubers get called, because the Uber driver, that's an unfair thing.
Absolutely.
Yeah.
I'm surprised they even take you in.
Well, they don't even know.
Wow.
That's so dangerous.
Wow.
But that's what our healthcare system is leaving people to resort to. And I work in a community health center, so a lot of people don't have money and are not well off. And as a result, they're facing even bigger struggles. Like, I'll give you an example. Patient walks into my office, diagnose them with a sinus infection. I write them a prescription. Here's a doxycycline. It's an antibiotic we use. Send them out on their way. They go to the pharmacy. Their insurance denies it. They have to pay out of pocket. Why is your insurance denying a common antibiotic? Oh, because the doctor prescribed capsules and your insurance only covers tablets.
But they don't tell you that. Oh, so
How
sad.
can I know that as a doctor? What this
whenever-
person's insurance covers?
I'm sure you'd agree with me. Whenever you call an insurance company for anything, it's a game of what they can pay.
Yes.
You have to outwit it almost. And it takes a lot of time.
The shady part of insurance is this. If you argue enough, you can get everything you deserve.
While you die waiting.
Yes.
Yeah.
So the goal is that they outlive you, the insurance company, literally, as evil as it is to say, or that you won't want to jump through the hoops or don't know how to jump through the hoops, so they don't have to pay for it.
I'm sure that's true because that's the feeling you get talking to them.
Yeah.
Yeah.
Like if I order an MRI for you, for let's say we have a good reason, and I know it's a good reason because I'm
Order
a
it
doctor.
anyway because that's what my
What change of healthcare would be most effective to improve outcomes? I think the best thing would be to make it single payer so that every single person can have the top level health coverage delivered at the same speed and efficiency as we do right now in the United States. I think that would just solve every single problem. And then our life expectancy would go up to 95.
parents died of. I'd like to get one tomorrow, please.
No, we don't get random MRIs for
Okay.
screening. That's not a good
Just
thing
a
either.
checkup.
No, that's we got to talk about that too because that's important. But let's say I ordered an MRI because we need something. Let's say I'm following a patient's tumor size. So I'm like, we need an MRI to see how the tumor is behaving. I order it. The insurance company will deny it. I will call them. I will say the patient needs why? Because of this. Did you get a CAT scan first? No, they don't need a CAT scan. They need an MRI. No, they do. And I have to argue for 45 minutes.
Yeah.
Guess what I don't get paid for as a doctor? Well, for me, I'm a weird scenario,
Time.
but everyone else, time.
Well, you don't have to because you make so much money here.
Well, I'm lucky. But if you're a lawyer,
Yes.
are you doing anything for 45 minutes
No,
without
not at
getting
all.
compensated?
Not at all. Yeah.
Is that unfair?
Yeah. And I don't find that doctors will call and argue. That's not been my experience.
Okay, most doctors will try, and then we fail. So then we start trying to hire administrators to do it for us, and that is why healthcare costs have ballooned.
Like a lawyer's job is literally like communicating with people and doing like that's their job. They get paid for that, of course. Like that'd be like being a massage therapist, and then you're hanging out with your partner, and then somebody complains about something, and they're like, oh well, do you get paid when you give your partner massages? And they're like, fuck, you're right. No shit.
In this country.
I see.
You would think our healthcare costs have doubled, tripled, and doctors should be making way more money. They're not.
Yeah.
The costs are going up because for every doctor, there's like, this could be wrong, but in the range of 10 to 15 administrators.
Wow.
Because we don't understand. Like I order antibiotic, I don't know which tablets, capsules. The patient's insurance denies the visit because I didn't put the right code or this and that. I'm a doctor. I do science. I do the body. I don't do codes.
Yes.
But now you have to become like a business person, a lawyer, a doctor, all in
But
one.
again, the objective of the insurance company is not to pay.
Yes.
That's the main thing, not to pay.
Yes.
Yeah. I believe that.
So they're inherently like broken.
Yeah.
That's sad. Oh, let's talk about your MRI thing because I'm passionate about that. Do you know why we don't just get random MRIs on people?
I imagine you have some downside to it. I don't know what it is.
So MRI doesn't.
He's just making a point on the fact that doctors are doing extra work. Everybody does extra work that bills anybody for anything. It's a fucking retarded point that you're just not even fucking thinking about because you've never been a small business owner or you've never worked a job that doesn't require you to do all these things. Every single person does this, right? Like if you're a plumber, oh, not only you're a plumber, but now you also have to like know all the fucking New York state laws and you've got to know how to do invoicing and run Excel and do QuickBooks and do, yes, hello, welcome to every single fucking business ever that ever bills anybody for anything ever all the time. Yes, that is correct. Every single job has to do this. It's not unique to doctors. Oh my God, I just want to be an auto mechanic and now I have to know how to bill an insurance company. Now I've got to know how to how to call a rental car for now I need to go to Enterprise and get an account. Yes, that's every single business owner job fucking ever. If you're a doctor and you work for a hospital, you don't have to do these things. The hospital does it for you. Or if you've got a private practice and you sign up and the guy has a fucking administrative staff that does this. Yes, every single business in the United States has an administrative staff behind it. That's not unique to fucking doctors. Jesus.
Cause radiation, so it's not like a CAT scan, so that's not a problem. But if you're just doing a test for screening, which means that you don't have symptoms, you're otherwise healthy, and we're just testing to make sure everything's okay, you need to be able to be sure that the thing you're testing for is actionable and that you would want to go through with the plan.
Oh.
So for example, let's say I have a patient who's having bleeding down below, like bathroom bleeding. And I say, you know what, we need to do a colonoscopy to find out the source of this bleeding. And the patient says, I would never have a surgery to take out a tumor. There's no point to do the colonoscopy.
The more charitable interpretation of his point is you would think, given the increased cost of healthcare, that doctors are similarly making much more, but that's not the case. It is the doctor version of two. Aren't doctors like the most well compensated people in our society, in like educated society? Like aside from actually owning a business, what other W-2 job is there that earns more than being a doctor? Can you give me a single job? What is the highest paid W-2 job in the United States? Lawyer? Do you think lawyers on average earn as much as doctors do? Median lawyer salary, USA. Oh, I need to use that BLS thing. This USAFacts.org says 136,000. Median doctor salary, USA. USAFacts.org says 230,000. Physician salaries are not matching the increase in healthcare costs. That's fine. I doubt any industry scales one-to-one with, still, I'm just saying the idea that they're not getting paid enough, like compared to what?
Absolutely.
Because they don't want the end result, right? So you adjust. With screening MRIs,
However, they could change their mind when they find out what's really wrong with them. They might get scared and revisit it. Or they might have a wife that badgers them. Well, any of these things are possible.
Oh, Jesus. The highest paying occupations. Huh. Crazy that anesthesiologist is literally number one, and these are the people that you fucking retards simped for in their fight to keep their costs as high as possible. Good one. Are ordinary people required to have insurance in order to survive their average medical bill?